Good afternoon. Welcome to African Voices platform on Sheffield Live TV. My name is Chiwe Chihana and I'll be your host this evening for this very important COVID-19 dedicated show. My guest in the studio today, well, over Zoom, is Nighat Basharat from Sharrow and Netheredge, one of the food banks there. At the height of the pandemic, a lot of people in our communities were rising up to support those who were extremely vulnerable. I'll be talking to Nighat about that in a moment. Nighat, welcome to African Voices platform on Sheffield Live TV.
Hi, Chiwe, and thank you for having me.
Thank you so much for joining me. It gives me so much pleasure that I've managed to finally get a moment with you, given how difficult it's been because you've been so busy throughout the pandemic. Can you talk us through the beginning of how you got to be so involved in supporting the community where you are and about the place where you're sat right now, actually?
Yeah. First of all, during, I know everybody played a big part in the community during this pandemic, and it was something that was new, very scary at the time, I can remember. And when everything started, there was a lot of panic within the community, even more so my own community. As many people already know, I work in the community with people affected by mental health. And within the Sheffield Health and Social Care Trust, but also with people affected by thalassaemia, which is a genetic blood disorder. When this happened, I immediately tried to understand this myself, like going on different NHS website, ringing Greg, who's the public health worker, and just understanding so that I could actually
So just to be clear, that's Greg Fell we're talking about, the Director of Public Health in Sheffield. Okay, yeah. Uh-huh.
So because the health conditions that were highlighted, thalassemia wasn't on there, and it was a bit confusing, what information to put to them as well. So some were saying just follow the same rules as everybody else, social distancing. And I got a clear information that it was basically they all needed to shield. They come into high risk category. So getting all that information, sharing it to all the thalassemia families and carers was one thing. Then working within the trust, there was a shortage of workers, support workers, because a lot of the staff went off sick and had to shield as well because of their health conditions. So I just felt it was a duty for myself as well to come forward and help the trust that I really, feel passionate about the work that within the mental health area. And I've been working there for now coming to 4 years. Then during all this, it was a nightmare. It was very, very tiring, scary, but I never let go of the responsibility. I felt it was within people like myself and other people that if you can gain the information and pass it to our communities to educate them to be able to understand that, what this virus is all about, social distancing, staying at home. I think one occasion when I was speaking to a couple of families, one was a Pakistani family. Through the support that I was giving, reassuring with their anxiety, I identified that they were struggling for food as well. But upon mentioning that, she wasn't quite open, and basically I said, if you're really
so this is you doing your work for the trust, and then as you were getting on to speak to people and spreading the word, you came upon this case where a woman was struggling for food but had not been speaking about it, was not comfortable, right?
That's right, yeah.
Go ahead.
And when I mentioned, have you reached out to anybody in terms of food banks, and I'll surely mention, before this time I've not been involved with food banks, so I've heard about them, but I've not really understood what they do and all of that kind of stuff. So I could remember S2 Food Bank, so I basically thought, I mentioned to the lady and she said, no, I don't go to food banks.
Yes, go ahead. Mhm.
So this individual, I mentioned to reach out to a food bank, but she didn't want to and she gave me reason that it's people will laugh, and I can't go there, and I wouldn't ask as well. So I tried to reassure her that, you're not on your own. At that point, I didn't identify other people who were struggling for food, but I just reassured her that if you're struggling, it's nothing to be ashamed of. And do you want me to see if I can find out what support there is? So, she was hesitating, but I then took the initiative because I knew that she wouldn't go and ask anybody. While I was doing that, there was my own, obviously, thalassemia individual who I was supporting, who was very suicidal. That was very, very frightening at the time, because he was in lockdown, and because he was.
What is thalassemia? Just for people who don't know what that is, what is it?
Thalassemia is a genetic blood disorder, which is one of the common genetic blood disorders in UK. But unfortunately, we've got very, very low awareness around this condition. And it's where anybody, like any of the viewers, could be a carrier without even knowing, because you can only be identified if you're a carrier if you actually have a blood test. And when you've had the blood test, if you do identify that you're a carrier, there's nothing wrong, nothing to worry about. It's only when the individual gets married to a person or has a child with a partner who is also a carrier. In that case, what happens is the couple are born with a child with thalassemia, which means the child can't make its own blood, red blood cells.
Right.
So they have to rely on hospital blood transfusion every month to be able to actually, keep up with everything.
Does thalassemia affect the Black BAME community differently, or is the statistics similar in the mainstream community as well?
It's highly prevalent in the BAME, more prevalent in the this highest is Cypriots, and then Asian Pakistani community
Right.
are the second largest people prevalent with thalassemia. But I just want to highlight that it does affect all social groups, but unfortunately it's very high in our
The
communities.
statistics are higher, right?
Yeah.
Okay.
And
So obviously it meant that there was this double-edged problem that you had to deal with because the community you are in is directly impacted by COVID as well as thalassemia. Go ahead then. Thank you.
So basically with this individual, he was already having mental health issues as well as obviously having a blood disorder, thalassemia, no family in UK. And but because of not understanding the full, obviously there was a language barrier there as well. But this individual was, these were his own words, he was very stressed, and he said that if you didn't actually call me, I was thinking of either taking drugs or actually having alcohol or just actually committing suicide. He goes, I just couldn't take it because I didn't know who else to reach out to. But I do regular, I did more than regular phone calls, just so I do regular phone calls anyway, but during COVID, it was more than regular, and even more so the ones that were very stressed or anxiety issues that they had. There was a big issue around, having hand sanitizers. So this individual thought the way the publicity was going and everybody going crazy for the hand sanitizers, he thought and was very stressing himself that if he didn't have hand sanitizer, basically it's gonna really affect his health. So I educated him around that and basically mentioned that you've got a sink and water, and that is the best hand washing you can actually do. And hand sanitizers are only there if you don't have any soap and water. So basically, I encouraged him to. He drives, so I goes, it's okay for you to go into your car, go to the hospital, have your blood transfusion. There's hand sanitizers there, so I'll use them. Once you finish, come back into the car and straight home and just wash your hands. And I still remember the ease that he had, and he goes, you don't know how much you've really helped me just by educating me on that, because he was saying he was really stressing over that. So basically that was another individual who identified he didn't have no food in the home, again financially no money, and also was panicking to go outside as well.
So it's those kinds of stories, Nighat, I think that set apart. I mean, it was the initial message was that we should all stay at home, stay alert though. But there were warriors of the community like yourself that did not stay at home because you had all these people that you needed to work with. And that led you to just mobilizing amongst yourselves. So where are you located, just so people know, and where is the area of focus that you've been working in during this period?
At the moment, thank you to this Wajid Nazir, who's from One Nation, and also Families Relief, Mashood. At the time when all this, I identified there wasn't any halal food support. Because every organization in my area was in lockdown. So no fault of theirs, but I just felt I needed to get this support in place quickly, because I was slowly identifying more people and more families that wouldn't actually come forward, more specifically even more so from my own community. So I thought there was no way I could do this on my own, because I didn't have any food handling, experience and that side of stuff. So I did approach with the recommendations of people in the community, because they know I was looking, the Families Relief and Aspire Foundation, that these guys actually do that kind of support where they provide food and all that. So contacting those, obviously informed them that this was basically a desperate need and there's a gap in this area, and would you be able to help? And thankfully, both of them, after consulting with their committees, they came on board and agreed to, work together, because I said, because it's this type of virus is that you can't actually work in isolation, and it was around coming together, and also not going too far as well, because I was making sure that not to spread the risk, and not to protect myself as well as protecting the community. So every little thing, there was a lot of thought put in it, how these organizations were approached. And then there was another two brothers, Sohail, Mumtaz and Wajid, who also said, we've got cars, if you need any support, drop in the food packs and everything, let us know. And slowly, there was no plans for a food bank, Chewy. It just one step. I can remember running here, trying to sort out what packs are needed, and then also running to the hospital because there was shortage of staff there as well. So doing stuff there, running back to the food bank. But if it wasn't,
I remember that period because I was really trying to get a hold of you to talk to you about what you were doing. You just didn't have time. You didn't. So you were really running around quite a bit doing this work. Yeah.
I think anybody who actually saw what I was seeing would have done the same thing. It felt like a responsibility. It felt, shall I say something? I cried. Not just myself, even some of the brothers here, when they saw the people that were coming forward, they got emotional too. And I can just share one lady who came to the food bank, and while I was putting the stuff to her near the door, sorry, just those memories coming back.
And this food bank we're talking about is where you are right now, that space you're in. So this woman comes into the food bank here.
So she stood outside, and while I was passing the food packs to her, the third pack, when I was just pointing to her, I looked up and I said, these are, but feel free to come back or let me know and we'll have some. And then she just broke in tears. I felt like really hugging her and but obviously because of social distance. But before I could even say anything, she just went. But I followed, the support afterwards by giving her a phone call and just, seeing if she was okay. And the words she said and the prayer she gave to everybody here, no money can actually give us that. And it was an experience that really made us feel the value of what we were doing. It was very, very rewarding. The stories that brothers have shared, unfortunately they can't, join today, but each individual that was on board, like, we worked so hard that we had it was like just making sure that nobody was missed. That's how tirelessly we worked, forgetting, like, we've got families and other responsibilities and everything. But I think this is, as a Muslim, and the brothers being Muslims as well, we felt this was it. It's a testing time for all of us. We take care of the community and these individuals, and God will take care of our families.
So you were you and the community, and this is pivoted around responding to the needs of the Muslim community at the time. It was initially that, but that also speaks to a gap. Obviously, there was a gap there, wasn't there, that you needed to fill in. What gaps were those that you were responding to?
The gap that I found was there was no Halal food bank or Halal food packs. When I approached the S2 food bank, they were struggling themselves. So basically, with the team and with some volunteers, we obviously got a list of what items they were struggling with, because there was the supplies were limited, and they were struggling. So basically, I did a flyer and shared that around, and with that we got a little bit of money. And also Aspire Foundation had a link with the cash and carry, so we managed to get those food items. When we went to drop them off, I asked this question as well, because my back of my head was those families who I identified. So it was then that the lady mentioned that we do have a few calls, but we could do with some support with some halal stuff. When I came back, and that's where obviously this initiative came about, the gap of halal food bank, because in the area. And then I looked far wider, actually, within Sheffield, but there wasn't anything that I could see, or the people who I asked, any halal food. So I think from my what people have informed me, this is the first halal food bank that we started off in Sharrow, Netheredge, and that was the gap, Chewy. And here, what I will say is thank you to each community member, and also the people with businesses who fought within, like, reaching out to people. They actually came and gave stocks of, chapati flour, rice, like lentils, things, the staples that we, as like the Pakistani community or the BAME community, that we actually have. And also, if it wasn't for this space, I was very much struggling for space. I've got to thank Jim Stanky, the councillor. He, from start, he's been chasing and finding a space for me to be able to be able to have the stock. But we couldn't actually get that sooner. So this is where Wajid Nazir actually mentioned that there's a space. I've got a shop and I can open that up for you.
Okay, so just to, because I think this is a very important point you're bringing up, and I really want people to understand this. So you did not have space, having been doing all this work, but the need for the space, a dedicated space, arose, and you had support in searching for this from Councillor Jim Steinke of Sharrow and Netheredge, and you spoke to Wajid, did you say?
Yeah, Wajid and Mashood.
Okay, so pick it up from there, yeah.
Yeah, first, because there was a desperate need, because donations started coming in, and the first point of contact Mashood from Families Relief said we've got a shop on Aberdeen Road and we can use that. And so we started using that on a temporary basis, but people who know that shop, I mean, it was my first experience. It was very, very small and they have other stock of their own. So bless him, he was there to take the stock, whoever actually donated, like Morrison's supermarkets, they actually donated quite a lot. So thank you to all them supermarkets as well. So from there, we found that social distancing was not possible when we were sorting the stock out and everything. Still following on, Jim was still trying to see if we can get Sharrow Community Forum space because they were trying to, this virus was something that everybody was trying to put things in place to be able to, you know, use the space and all of that. So the demand was getting, there was a lot of demand, stock was starting to come in, people were starting to donate food stock as well. So that's when Wajid, when he realized that we were looking for space, he then mentioned this shop on Aberdeen Road. So that's when we moved from Families Relief shop to Wajid's shop, which is a space that is on Aberdeen Road. So thankfully, if it wasn't for this space, I don't know where we would have actually stocked stuff. I had no space in my home, or I haven't got a big garden.
And this is the space you're in right now. Could we have a look at a look? Just talk us through, if you can manage without shaking the camera too much. Just show us the space and what happens in there.
Right. This is the shop that we have, and here we have a board which we put on. Just we do some packs which are like single packs for individuals, and then if it's a family, we have a single and a family pack. Right. And so when we do something, we just add it on there. So between us, we try to come down and make the stock and put the packs, total number of packs on there. These are the lentils and the rice that people have donated. So we put them in these kind of packs so that it's easier, because sometimes we get larger packs and we break it down into these packs. Then we've got fruit. We tried to make it a variety so that they've got all the nutritious.
Could you lower your camera to the fruit? I can't see it. Yeah. Okay. I see.
Tins of mixed fruit, and then we've got rice pudding, jam. And then these ready packs, because we've got a couple of family individuals that cannot cook at all. So we try to get ready-made stuff so that all they have to do is, like warm them in their microwave. So these are a few. And then we've got some jam, pasta, and pasta is easy to, like boil. And so the individuals, like the team that I'm working with, between us, they explained, what kind of food items we should actually put in. And a lot of our Pakistani community, we use a lot of this tinned
tomatoes
when we're doing the curries and stuff. So we've got tuna, beans, baked beans, and then these are mixed vegetables like carrots and mushy peas and stuff. And then we've got some juices here.
Right. So if you go back to where you were sat, then I can just pick up. Thank you so much for taking us around. It looks like a very effective operation, and well done to all the community members that have been supporting you, Nighat. Well done. That really looks. So how many families or individuals do you expect in a day, at the very least, that you support there?
We do our distribution every Wednesday, and we give out 165 we did this week. 165 are our regular vulnerable families. And this does change. When the lockdown eased, there was a few families that and individuals who mentioned that the difficult time we're over with that. We've got a job, or our daughter or son is working now, or they're not shielding. But we review this regularly to make sure that, you know, the money is going to the right people, because it's all money raised from the community, and you're probably already aware that is no funding is put in this food bank. It's all cash donations and food donations from the community, which is why it is very emotional and a heartwarming feeling that the community, at a difficult time, when businesses were really struggling, they came forward. But then afterwards, you know, people are still actually donating and doing whatever they can. But yeah, it's just about regular ones are 165 that we have at the moment, and the in between, even though we have a distribution on a Wednesday, we do have like emergency needs. So which is why this food bank, we decided that it's going to be flexible. The reason being that just because it's Wednesday, because we later on we've noticed there are other food banks and obviously services that are extended and providing food packs. So we try to make sure that it's flexible so that nobody has to, if the food bank closes at 7 or 6, people don't assume that, you know, that's it, we have no access. So we've left it flexible, and when people ring, we have delivered you know, the food packs, or people have come at like 11 o'clock, 7 o'clock, or weekends. So it's been flexible for people, so there's no barriers. And you mentioned,
So how, yeah, go ahead, and I can ask you too.
yeah, you mentioned, you know, it was a gap for Halal Food Bank. It started off for catering for those communities because that was where the gap was, that people were struggling with the chapati flour. That was a big issue. And, you know, like there was the pasta and various other stuff. So when we came together, the five, you know, the organizations and the brothers and a few others, we felt it was important to drop the halal food, halal word from the posters, because we didn't want to cause a barrier to people who are not non-Muslims. And that's where we made sure that you know, like people were well aware that it was halal food, vegetarian, vegan, and gluten-free. So we're doing all of those. And these were schools that put referrals in, where I can share with you one family. Apparently, school mentioned that they were struggling with money. Single mom who had a 10-year-old child with gluten-free needs, and she couldn't provide. So they asked, the school referral asked if this was possible. So what we've done is, because we've only got 2 gluten-free individuals, so with that money we make sure that we go and get that gluten-free to be able to, you know, ease their difficulty. We've also got a vegan family again, so we try to make sure that, you know, wherever we can, so that nobody struggles alone.
Are the families you are offering support to, maybe you could answer 2 questions whilst telling me this. Are the families, the core ones, the 165 people that you're supporting, primarily based in the Sharrow and Netheredge area? And does this speak to what's available for the community? If people are watching here, this is what you want people to understand, that you're there for them.
Yeah, it started off with a focus on Netheredge and Sharrow, but we've had a majority are from this area, but also like Healy and the surrounding areas. But we have people coming from as far as Rotherham, Darnell, Fir Park, other food banks from Fir Park, like Fir Park Food Bank, put some Pakistani family referrals here as well, because they said that we don't have the type of food that they need. But what we did was, the reason being, we tried to signpost them to their own local any support that's there. Some of the reasons why we have those individuals and families is because they felt embarrassed to go to their local place, because they didn't want people to know that they were asking for a food pack. because we tried our best, because we tried to make sure that we justify, the food, the money that we were raising for Sharrow Netheredge. So those families that we have from other areas is only because they don't feel comfortable, or they don't have the right support from their local areas. We had one key worker from Worksop, and she basically found our contact number from somewhere, and she mentioned, and that was another emotional story, when a key worker has to come all the way from her own town to a food bank in Sheffield. We did ask, and she said there was no support that she had or she could access. This was during that COVID time, the early times. So we provided a full box of food items with toiletries and stuff like that, which she came every week to actually collect. Unfortunately, I think it was a month ago, she shared with us that she lost her job as well. So it just shows that, we felt so proud that we could actually support people around, Sheffield, South Yorkshire, as well as, other towns, just from this small shop here. And this is thanks to all the donations, cash and food donations from this lovely community that we have in Sheffield. And it makes me emotional. And I just love our communities, really love what they've done, really love how they've come forward in a time when it was very, very difficult for all of us. I've seen loads of people cry within the hospital, the managers, the workers, then coming home, and as we were delivering and doing these things, we cried together. And it's something that I'm very proud of, I'll be honest. I'm really proud of all the team that's working here and what they've done, and within the community as well. So I don't think we've done this on our own. I think everybody has played a part in making this successful.
That's very powerful. I also realize that there's also other work going on, and especially because I'm obviously quite focused on BAME activities, and I'm aware that the BAME community was disproportionately affected by COVID, be it health-wise or indeed financially, income-wise. A lot of people lost income in that sense. So there's a BAME strategy that's being developed by the BAME. It's a BAME COVID-19 strategy that's being developed by all BAME groups that have been working on COVID. And I wondered if you've been able to feed into that. That's being led by Faith Star, and what you would want to see coming out of that strategy, if you can feed into it.
Yes, I was invited to that meeting, and I'm involved, in fact, the mental health with Mona and Shaida, working closely with them on this strategy. And I think it's very good that Shaida's actually took this step and put this together, because I think, like everybody said, there's been strategies, we've seen these happening before and whatever. What I see with this is the passion and the commitment that's been given, where whatever we feed into this strategy, it will be taken seriously, because there were council members on board as well, and I think, if I'm right, public health as well. So I think it's very important that the grassroots organizations and people who are working directly on the floor with these families and people, what we see is actually taken seriously into these strategies, to be able to provide the right support for organizations to be able to provide a good service to these communities. And I think one of the things is, a fair distribution of funding and sustainable ability as well with the resources, because if organizations are starting to do something, or being able to support these BAME individuals and families, whether it's in health, mental health, the housing, there's a whole range of things that have an impact on our mental health. And I think coming together, working together with these organizations, from the grassroots to the people who actually have the powers and the influence, with supporting and putting funds in to be able to make these organizations sustainable, to be able to provide a better support, rather than just putting something temporary in and then just letting go, and then it goes back to square one again. But I think sustainability and fair distribution of funds is very important.
Resources, I suppose. Yeah.
Yeah.
I think you're right. I agree with you entirely, and I do think that this is the most comprehensive kind of strategic engagement that I've actually seen in a long time that's targeted at the needs of the BAME community, because clearly we've seen now that there are huge gaps that people like you stepped in to fill, which should not really have happened. And much as we hate to talk about death, the truth is that a lot of people could have died without people from within our communities stepping up, which is indeed very powerful. The project you are running, you mentioned that there are 5 others. Is that right? 5 partners? You name them. Aspire?
Yeah. First of all, the initiative obviously was an extended service of Thalassaemia South Yorkshire, and the partners that have come on board are Families Relief, One Nation Community Centre, Sheffield Muslim Community Forum, and Aspire Foundation. And I think without these people, and these people, probably people are already in the community, already well aware of these individuals and their organizations. They've done some fantastic work in the community and are doing a fantastic work. And I think somebody mentioned to me, you've chose the right people, because they asked me a question, did you struggle? And I feel maybe I would have, but I think the team that I had and the community support, I think it was a blessing, and it just made it flow. The only struggle I think we had at the beginning was where are we going to get the money from to be able to support? And I think thanks to God, first of all, we put money from ourselves, all of us put something in to be able to start something. And then once we started the GoFundMe, believe it or not, I think if I'm right, I think we raised within a week or 2 weeks, 700 and something pounds. And that was purely from the community. And it was a time, truly, when everybody's going through hardship. Actually, it amazed me. I literally, I was just like, this is a blessing. But yeah, it was one of those things that, whatever we saw a gap, we thought, let's try. And whatever we put our hands on, whatever we tried, with the blessing of God and then the community, it just happened. And I've got to say, the hard work, it wasn't easy. There was a lot of time put in, a lot of commitment put in. And the biggest thing was, it was the passion. When you have the passion that you want to make sure nobody struggles, and you just get on with it. And I think that's what I saw within this team. And I can never forget this team or the work, because when I see the feedback, some point, if I get opportunity, I will share. The feedback is amazing. It makes you cry. It makes you feel rewarding what you've done. It just makes you feel that I wish one day, if we ever go through anything like this, people do come forward exactly the same way.
I have been looking at I've been looking at the community responses, very specifically at the BAME communities in and around Sheffield, how they've responded to COVID-19. I have to say, it's phenomenal work. It's phenomenal. People like you have really saved us. You've really saved our communities, especially people who needed to shield. You were there for them. People like you made this happen. But we need this to be sustainable. Of course, this is why we are saying we need support. We need this strategy that engages with the policymakers, local authorities, So we are not having to do these on our own or funding them ourselves. What is the vision beyond? I mean, COVID hasn't gone, it's just eased a little. So I'm imagining the pressure has also reduced somewhat because people can get around as well on your part. But what's the vision in keeping with your particular food? What's it called again? Netheredge and Sharrow Foodbank.
Netheredge and Sharrow Foodbank, yeah.
What's the vision beyond this period? Going forward, what do you want to do with it? What can people come to you for?
Okay. At the moment, after assessing and reviewing the food bank, which happens the next one I will be doing in September when kids are going to be going back into school. So far, with the information and the review that we've done, I feel we need to continue. So Thalassaemia South Yorkshire will continue this service probably till, for now, December we're looking. And then we do need a bigger space because of the stock, tourist stock is not, there's a lot of health and safety, because at that time when we did it, it was we just did it. But now looking at everything else in place, like there's no sink and water here, sorry, yeah, there's no toilets here. So basically there's no hand washing, so we obviously have to go through a lot of all these kind of stuff, and you know, like the wipes and stuff. Also Wajid, obviously this was a temporary space he gave us to use.
And
at the
Wajid
time.
is Aspire. So when you tell me Wajid, one nation, yeah.
So we don't want to put too much of a burden on him because he's done so much. We have to thank him for, because that was a temporary space he opened, but we ended up being longer than what we should have been because of not having any space. Hopefully next week Jim is helping.
This is Councillor Jim Steinke,
because from day one there's been, you know, we've been chasing up certain places, but I think we've identified a couple of bigger spaces which aren't being used as much at the moment. So on a temporary basis, hopefully next week we should get some news in terms of having a bigger space to be able to continue the service to at least for now December, and then obviously review, because Chewy, you know, if there was support in place from day one, or there was something, we wouldn't have even done this food side of stuff. So at the moment we've still got, you know, I've spoken to these people who have collaborated from day one with, who've helped me to now really tirelessly with full commitment, everything. So I'm hoping some of them will continue till the next stage, but I totally understand even if some of them can't, because they have their projects to run, other things that they have to do. So I still respect whatever their views will be, but I think most of them will be continuing with me. But for the community, I just want to say that we still need your support in terms of cash donations and food donations. Supermarkets, your donations have been amazing. Like, I've got to thank, you know, the Costas and Morrison's, Sainsbury's, Tesco's, Morrison's. From every store in Morrison's have been amazing by giving, you know, donations up until since COVID, from March to now. So I really want to thank you know, all the Morrison's team for actually making this happen and thinking about the community. So thank you so much. But we still do need the support.
You still need support from everybody to keep this going, definitely. How do people get to you? What's your address? Where do they take these things if they've got them, if they haven't heard of you before?
Okay, we're based at the moment at Aberdeen Road. I always forget the address. It's
any landmarks? What's it next to?
Basically, it's just opposite Brofield Hotel Tenants and the old primary school on Aberdeen Road. And it's on Aberdeen Road. and that's why we're taking all the donation. But before people donate, there is a number to contact, because we're all working, the jobs as well. So we try to manage it that way by people ringing the number, and then we arrange a time and we open up the shop. And the number is, I can
Go
give
ahead,
you,
yeah.
079 88 033 534. And any donation, small or big, are greatly appreciated.
Thanks a lot. Nighat, it's really been wonderful finally getting to sit down, because I know how busy you've been with doing all the work you've been doing. And great work to you and your team. Thank you so much for joining us on African Voices platform for Sheffield Live TV, and I'm sure we'll hear a lot more from you. Thanks for all the work you've done.
Thank you so much, Chewy, as well, for having us. Thank you.
Thanks for joining us.